Well, our first guests are joining us here in studio, two gentlemen with a company called Fresh Start Private Management Incorporated. CEYY is their stock symbol. To my far left is the Chief Operating Officer, Brady Grenier. Brady, welcome to the program.
Thanks for having us.
And in between us, Dr. George Baillargeon. Welcome to the show.
Thank you, Don.
And I understand you're a consultant for the company.
Yes, sir.
Now, Brady, you describe your company as providing leadership and motivation for the treatment of alcoholism. It's a fascinating subject. Can you give us a general overview of the company?
Yeah, it actually is very fascinating. When I first heard about this program that was introduced to the U.S. a few years ago, the company has a program that treats alcoholism on two different approaches. We have the rights to a very rare, long-lasting implant of a drug called naltrexone, which is an FDA-approved drug. We have it in an implant form. We have the worldwide rights to that implant all around the world except for New Zealand and Australia. On top of that, the company has developed a life coaching program to go along with that implant. So together we created this program that's a two-pronged approach to treating alcoholism that Dr. Baillargeon can actually get into the scientific parts of it later. So we have this program, and the clinics that use this program are reporting to us that the success rates are 85% plus. And they do those by routine telephone interviews and consultations with those patients for a year or 2 years. But they're reporting to us that these people are sober for 85% success rate, with those that complete the entire program, which includes the implantation, followed by 14 to 16 or so life coaching sessions that go on for 6 to 12 months, depending on the patient's or the person's the progression that they take and that they choose. So it's very flexible, and a lot of people can do this from home. So that's another great thing about this program. It's a procedure that takes place in, a few minutes. So one day of work possibly they're missing, and then the program will take it from there for 6 to 12 months, depending on the person. And the company, what we do is for our model is we provide this program to independently owned clinics, physician-owned clinics around the country. And another model is that we license this program to people who want to do what we do in other territories and other states. Currently, we have licensees in Northern California, Nebraska, Connecticut, and Arizona. So that's part of our business model as well.
Well, Dr. Baillargeon, now, naltrexone basically it blocks the part of the brain that feels the pleasure from alcohol. Can you tell us a little bit more about that?
Sure. It's fascinating. The treatment of addiction in our country and worldwide, alcohol addiction in particular, and these things are of epidemic proportions that transcend and cross every social, economic, racial, physical barrier. I mean, everybody's affected by somebody with alcohol abuse. The treatment has been woefully inadequate. More or less, alcoholics have only received what we call talk therapy or psychosocial type therapy. This is exquisitely important. It's very important. And you can have counseling, therapy, residential therapy, 12-step programs. You name it, it exists. But the success rates are woefully inadequate. Why is that? It's because the physical aspect, the physiological aspect of addiction has been ignored and underdeveloped. Okay, an addiction is recognized, there's no ambiguity, it's a disease of the brain, it's a chronic disease that's no different than diabetes, hypertension, asthma, and it needs to be treated as such. So there needs to be a physical, medical approach to the treatment as well as the psychological approach. And they both need to be present to have the optimal success. Naltrexone is a very effective medicine. It blocks these receptors in the brain that people get the reinforcement, that dopamine reinforcement loop that fuels all addictions is a part of the brain that the naltrexone blocks those receptors. And so by blocking those receptors in an alcoholic, they are not ravaged by these intrusive cravings and urges to drink. And by removing that, people can focus, they can be receptive, they can receive with clarity the psychosocial component of their recovery, which will be intensive initially, and then they'll need persistent attention lifelong because it is a chronic disease.
Well, now, of course, other companies will use an oral or injection method to get the naltrexone into the patient. Why is your implant method more superior?
Exactly, and that's a great question, Don. The oral form has been around for a number of years. It's hardly ever utilized. Less than 2% of alcoholics receive medical treatment, but it's not very effective because patients in general are non-compliant with their medicine, but alcoholics are the most notorious of non-compliant patients. They just simply won't take it. And if they miss a dose, if they sleep in too late, if they go on vacation, they don't go to their doctor to get a refill, or more commonly, let's say for a month and a half they do well, and they delude themselves into thinking, I don't need the medicine. They don't take it, and then they risk the very severe consequences of slipping into a relapse. The injectable form lasts 3 to 4 weeks, and that's a better alternative, but that still requires a good degree of compliance. Every month you have to make an appointment, you have to wait, the levels start to wane, you have to get another injection. This has to go on and on. All data has shown and indicated that the longer you can keep someone sober, those circuitry in the brain can repair itself. It's a chronic disease of the brain, but the brain can repair itself. So with sobriety and with coaching and counseling, the malfunction of the neurotransmitters and the receptors, everything can settle and be repaired. And so more or less there's, those circuits are repaired, but the longer someone is sober, the higher chance of that happening. And our implant is the longest lasting implant that's available. It's the longest lasting vehicle for naltrexone that removes all compliance because it's surgically placed in the skin, and it slowly releases this medicine from anywhere from 6 to 10 to 12 months, depending on the individual and their metabolism. It eliminates the cravings, and they're allowed to focus on their recovery, the psychosocial aspect of their recovery, and the success rates are exciting, promising.
Well, now, Brady, what was the company's motivation to get into this industry?
Well, our founder, who's not here today, Neil Muller, his wife was an alcoholic. He's from Australia. And for this company, she was patient one in Australia. They came across a doctor in Western Australia that was performing these implants. And his wife was a patient. He was intrigued by it. And the amazing thing about this business, as Dr. Baillargeon can tell you, is that anyone who's ever exposed to it, like I worked at Clear Channel, and they were a client of mine. When you start meeting a few patients that went through this program, you're so intrigued, you want to be a part of it in some way, shape, or form. And that was my experience. But Neil Muller founded it, and he decided to take the company, or he was enticed by some investors to take it to the U.S., and he moved his family here and set it up a few years ago. And the company's gone through a lot of changes since it came here, and last 2013, in my opinion, has been the restart of this company. We brought in a whole new executive board, a lot of advisors, and we've really got this company on the right track. And so now from here, 2014 looks very exciting with the things we have going on.
Now, you'd have to be living under a rock, gentlemen, if we didn't know that health insurance has changed in 2014. How does health insurance apply to your program?
Well, time will tell. With Obamacare, we're not sure yet. Apparently, everyone is supposed to have mental health coverage. Okay. But I think that was supposed to be the case in the Clinton years as well. Okay. So let's wait and see how that unfolds. Insurances are, they don't typically like to pay, but so we're going to have to see how that transpires. Now, we do have some clinics. The clinics are reporting to us that some insurances are paying, some are partially paying, so which is very exciting because now, traditional rehabs, insurance has never really been a factor. It's been a lot of, cash pay and very expensive. So the fact that insurances, or some of them, are subsidizing it somehow is very exciting as well. We just, in Q4, we had a major payer that told the clinic that they were going to begin to reimburse for it. So that's another exciting thing that just happened the latter part of last year.
If I can just add on, I think that it is exciting for insurance because a number of insurance companies, they're in the money game, and they recognize that this is cost effective to them. If they can prevent 1 or 2 days in the ICU, it's going to be cost effective. And so a number of the major players are receptive. They've already started to pay, I'm not going to name names, but the biggest major insurance companies recognize and are starting to reimburse our clinics. And Obama did just pass legislation that requires the insurance company, they're obligated to cover mental health and addiction medicine. So we're hopeful that we're already seeing a lot of momentum that is in our favor, but once these rules have been in play, there's no way for the insurance companies to wiggle out of it.
We are out of time, but I do want to get one more question in, Brady. Why is this a good time right now for folks to take a closer look at the company?
Well, for the reasons I just said, 2013 was a kind of a restart for the company, brought in a new CEO, Kent Emery, so hopefully we can bring him on one day. We've added to the board. We've sold multiple licensees. So right now, I mean, we've just have recently 2 clinics operating now, and we went from, actually we had 1 the last quarter of last year, and we've gone to like 4 now that are using our program. So that as that grows exponentially, we build that distribution footprint, because right now our goal is to have enough distribution nationwide so that someone can at least fly in and take an hour flight to get this program, because they can do that and get the treatment at home if they want. It's better to do it face-to-face, but our goal is to have that distribution footprint so we can help many more people. But right now, the exciting thing is we've been only operating with 1 clinic last year for the entire year, and we posted decent revenues from that 1 clinic. So the growth potential in this is exciting, and with the new laws.
Got to stop you there. We are out of time.
Okay.
They're screaming at me. But again, Fresh Start Private Management, CEYY. Gentlemen, we're initiating coverage of the company. Be following you very closely. I'm looking forward to those interviews as well. Thanks so much for joining us.
Thank you, Don.
Thank you.